guys, welcome back to Medical Coding with Blue. Today's episode is all about the medical coding certifications explained. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so today's episode I'm going to be talking about the medical coding certifications. Now there's lots of certifications out there and they all mean different things. There are some that are specialty, but today I am just focusing on 4 that employers are looking for when they are looking for medical coders. Now, I will say this also before I get into the 4. There are degree designations offered with the American Health Information Management Association. If you have your associate's degree in Health Information Technology, you are eligible to sit for the Registered Health Information Technician, or the RHIT. There is also the RHIA. If you've gone through a Bachelor of Science in Health Information Management, it makes you eligible for the RHIA, the Registered Health Information Administrator. Granted that you went through a program that is approved through CAHIM, right? They are the ones who approve the different colleges for their programs for health information, technology and health information management in order to be able to sit for the RHIA or the RHIT. Now, these 2 credentials are only if you want to get into leadership, and I will be discussing those on another episode. But for today, I am just going to be talking about the medical coding certifications that all employers are looking for. The CCS, which is the gold standard of medical coding credentials, because it says that you have mastered inpatient coding and outpatient coding. Then there's the Cpc-A, the Certified Coding Associate, that says you have the entry-level competence for inpatient coding or outpatient coding. The Ccs-P, which is a Certified Coding Specialist Physician-based, and that is all outpatient coding. And these 3 are with the American Health Information Management Association. And then, of course, there's the CPC, and that is with AAPC, or the Certified Professional Coder. When you don't have any experience, you will start off for the first 2 years with the Certified Professional Coder Apprentice. There will be an A designated on that credential. And I will get into more of what that means here in a minute. But I want to reiterate something, guys. When it comes to starting off in this industry, a lot of people are very confused. Which one do I sit for first? It's not about which one do I sit for first. It is about, number 1, what were you trained in? Not all medical coding programs are the same, meaning that they don't always teach everything that you need to know. Most times they will teach you outpatient coding, which is the ICD-10-CM, the diagnosis coding, the CPT, the outpatient procedure coding, and that includes evaluation and management and modifiers and all that good stuff. And of course the HCPCS level 2. That's all your bandages and your durable medical equipment and procedures for certain government insurances like Medicare for like their colonoscopies and stuff. They're also in there. But the thing that you have to know is this. If you are only trained for outpatient, and let's just say that whatever program you're in, they say that you can sit for the Ccs-P or the Cpc, and that's what they're training you for, then you have a choice of whether you want to sit for either one. You do not have to sit for both. There are schools that try to push people to get multiple credentials or to get certified through both the American Health Information Management Association and the American Academy of Professional Coders, because they claim that you can get a job faster if you're certified through both, which is not true. When you are brand new, there's a lot of challenges that new medical coders go through. So that's, again, another episode for another time. But the thing that you should realize is this. If you have a choice and they say, we're training you for the CCS or the CCS-P or the CPC. So again, the CCS-P is with the American Health Information Management Association. The American Health Information Management Association is a nonprofit organization. So their rules are a little bit different when it comes to like membership and CEUs and all that kind of stuff. And if you decide to go with the CCS-P, because plenty of employers will look for that, just know this. AHIMA, the American Health Information Management Association, does not require you to be a member of their association in order to sit for that exam. If you just want to take the exam, you could just pay their non-member fee and they will, get you going with the exam, right? Because you take them through Pearson VUE. And it is 20 CEUs for the Ccs-P, okay? If you decide to get that one, just know that you will have to report in your 2-year reporting period, because all these credentials, all 4 of them, they have a 2-year reporting period from when you get them, right? And you have 2 years to report your continuing education units. And that's what you do in those 2 years. So if you have the Ccs-P, this says you have outpatient knowledge, right? All you have to report is 20 CEUs when you get your certification, and you have 2 years to report it, okay? So you have plenty of time to collect 20 CEUs. With AAPC, if you decide to sit for the CPC, right? And you say, well, I heard about it, and, all my friends are getting that one, so I want to go ahead and get it too. And I just want to do that one because I heard that it's easier. It is not easier. You can fail it just as easy as you can fail any of these, okay? The thing about AAPC is they have an option that you can pay to take your exam twice. If you fail it once, you can, and you got the 2 times package, that you could take it twice, then you can take it again for free. Well, not for free because you're literally paying for it, but if you failed it first time, then you could take it again. AHIMA does not have this option, okay? And so that's just something that you got to know. But AAPC does, and they charge you a little bit extra for that, okay? So if you want to go through AAPC and you get the CPC and you have the Cpc-A because you have no prior medical coding experience, and they, you're just going to start off that way. You can purchase an educational product that is known as PractiCode. PractiCode is a collection of real-world redacted records. There's like 600 of them, and you go through and you code all of them. It is an educational product. It is not an apprenticeship, not apprenticeship, but an internship. It is not an internship. It is not job experience. What it is a collection of 600 records that you're coding on your own, because it's not multiple choice, like I said. And what it is what AAPC would consider what a coder would do in their first year of working, okay? And so when you complete all of this, then instead of a 2-year requirement for the apprentice status, you will have only a 1-year requirement. But if you've gone through one of their approved programs, that can also eliminate that 1 year. And then when you complete PractiCode, then you have a full-fledged CPC. Okay, so it really depends on which package you get. There is no problem with carrying an apprentice status, though. A lot of people are in such a rush to get rid of the apprentice status. I don't understand why, because you are still brand new without experience. And if you say, well, Blue, it's because nobody will hire a CPC-A, I know that's a load of garbage, because I write resumes myself for CPC-As all the time. It's never a guarantee. I will never guarantee my resumes, but I have written for plenty of CPC-As who have gone on to go find their first job. And so it really all depends on what you are putting out there as far as like your skills and your resume. Putting together a very good resume is the key to getting in, but a lot of you don't want to listen to that. So I'm just letting you know that that is the truth, because that's how you're getting judged when you go out there in the real world as a first-time medical coder, is the state of your resume. If your resume does not clearly and concisely list all of your skills and everything, and your skills is what you learned in the school, okay? If you do not have that clearly on your resume, that's a problem, because a lot of you are going to send out 4 or 5 page resumes, and employers don't have time for that. It needs to be on 1 page, but again, another episode for another time. But I will say this. If you want to get the CPC and you say, okay, you're fine with having the apprentice status, right? Because it says you have less than 2 years of experience, your CEU or continuing education unit requirement will be 36 continuing education units for the 1 certification. Plus, you have to pay a $222 membership fee every single year that you have your your credential. It's $222 right now. I mean, it could always go up because it's gone up before. So right now, the current price for the membership for AAPC in 2025 is $222, okay? Just so you know, that's just an extra added on charge. Now, yes, they do say that you get CEUs with your membership and things like that, so that makes it a little bit easier. But again, they have all these other supplemental credentials that you can get, like the CPC, not CPC, the CPB, the CPMA, and all these other things. Again, I can only encourage you to not spend all your money in the first 2 years because you have no idea what you're getting into, and this is already going to be difficult enough for you to be learning everything that you need to be learning, let alone trying to rack up all these other credentials, take these unnecessary tests that you don't need to right now, and then have to be responsible to get additional certification credentials, their CEUs, like the CPMA. A lot of CPC-As end up getting the CPMA, which is a Certified Professional Medical Auditor. First of all, you have no experience. What do you know about auditing? Second of all, AAPC requires people who hold the CPMA to get the CEUs from specific vendors. And these specific vendors can charge whatever they like. It is not mandatory for you to get a CPMA in order to get a job. Okay? Again, all employers are looking for is one of the four: the CCS, the CCA, the Ccs-P, or the CPC. If you want to go in and spend your money, you go right ahead. But again, I'm telling you, it is not going to get you hired faster. It is not going to make you more money. You can have a string of credentials and still make the same as somebody who has the one CPC-A. Okay, so that's just what you have to know there. So 36 CEUs for the one certification, a 2-year requirement, and then you work as a medical coder for 2 years, and then you can get that apprentice status removed, okay? Or you can go through the other way and pay to have it accelerated, the removal. I mean, it's entirely up to you. But again, if you have a CPC-A, it's totally fine. Plenty of people have started their careers, carried the CPC-A for 2 years, and were just fine because of it. Okay, so again, the CPC-A, a CPC, whenever you have it, is all outpatient coding, just like the Ccs-P. All right, it's all outpatient coding, and you can code anywhere. If you have the Ccs-P or you have the CPC or CPC-A, you can code anywhere on the outpatient side. So you can still work in a hospital because there's outpatient clinics in a hospital. I know because I work in a hospital in the outpatient clinic. So don't tell me that you can't work at a hospital because you don't want to work inpatient. Okay, that's somebody that doesn't understand what we're doing. Now, there is professional fee, which the example is that the patient is staying in-house and an outpatient provider is going up to the floor to go and see that patient. And you'll see those inpatient evaluation and management codes in your CPT book. So that way you understand what I'm talking about. They have the initial, they have the subsequent, and then they have the discharge E&Ms for those. So when you are coding for a provider who is going up to the floor to go see a patient, because that's technically an outpatient encounter, but even though the patient is staying in-house. And when they're staying in-house, then it's outpatient rules because this is an outpatient provider coming up to see this patient, okay? And so they have to get paid, and that's why they call it professional fee or pro fee, P-R-O, and then F-E-E, pro fee, okay? Something you have to understand in this industry. There's different things known, all right? Then we have the 2 certifications that include both inpatient coding and outpatient coding. When I say inpatient coding and outpatient coding, I am referring to inpatient coding, which covers, of course, your diagnosis coding, ICD-10-CM, but they have ICD-10-PCS. That's their procedures. When you say inpatient coding, you are referring to the facility fee, okay? The facility, the hospital, they have to get paid for the patient staying there and for the patient using their equipment and using their staff and using their bed and that kind of thing. So the facility needs to make money. So their facility is covered with that ICD-10 PCS coding. That's the procedure coding for that inpatient side, okay? For outpatient coding, of course, that's your ICD-10 CM. Of course, you have your CPT, which is your outpatient procedures, your same-day surgery, and your evaluation and management codes that are covered on that outpatient side. So the people who have either the CCA, the Certified Coding Associate, which says that you have the entry-level competence of inpatient coding and outpatient coding, or if you have the CCS, which is a Certified Coding Specialist, and that says that you have mastered inpatient coding and outpatient coding. The difference between the two is that the CCA is a shorter exam. It's like 2 hours, but it packs a punch in those 2 hours, okay? And the CCA says that you have that entry-level competence and understanding of inpatient coding and outpatient coding, and it has the most unique domains of all the medical coding certifications, okay? It's not broken down by chapter in the CPT book. It is literally, they have the most unique domains. So the CCA is a wonderful credential. I had it for 13 years. No one can ever say anything to me about the CCA because I changed hearts and minds. There's a lot of ignorance in this industry about these credentials. And the CCA, unfortunately, gets a lot of that ignorance because people think that they know and they don't know. The CCA is not an apprentice. It is a Certified Coding Associate. Let's just make that very clear. Certified Coding Associate. And this, again, just says you have the entry-level competence and knowledge of inpatient coding and outpatient coding. This person who has this is not only brand new to the industry, but they're very versatile in what they know. So, again, a very powerful credential to have. If you decide that, well, I want to go ahead and sit for the CCS, and I think I can do it. So that's a 4-hour exam, and it's in 2 parts. It's in multiple choice, and it is in your case studies. It's a little bit more in depth as far as the complexity goes of like the advancedness of the questions. So again, the person who has the CCS says that you've mastered inpatient coding and outpatient coding. So with that mastery comes more complex questions. And like I said, it's a 4-hour exam, so it's roughly 2 minutes per question. It's a little over, but it's just 2 minutes per question when you roughly think about it. So that's something that you have to be prepared for if that's what you want to sit for. And when you look at all of these credentials, the CCS, CCA, Ccs-P, or the CPC, not one of them is going to make you more money. Okay, a lot of people will ask me that too. Well, which one was going to make me more money? Okay, it's not about which credential you have, though each one of them says something different, as I've explained. CCA and the CCS both say inpatient coding and outpatient coding, and the Ccs-P and the CPC both say outpatient coding. So with that said, the way that medical coders make more money is through their knowledge, not by the amount of credentials that they have. Now, yes, there are some credentials that are specialty, like for CDI, the clinical documentation integrity, and things like that. So there's different ones. And again, they're all special in their own ways. But you have to know what it is that you're getting. And wherever you're working, they need to understand and recognize the value in order for you to be able to reach your earning potential with it. If they don't understand what the purpose is for a CDI, and they never give you the chance to use your credential or, apply that knowledge, then what are you doing there? You should be trying to find a place where you can exercise that knowledge and skill. And that's just my advice anyway. But again, I will say this, whether you decide to go for the CCS, the mastery, or the CCA, the entry level, either one is fine. You can apply for inpatient coding jobs or outpatient coding jobs or professional fee jobs, okay? Any one of these, because either one of these credentials say that you can code for any place, inpatient coding or outpatient coding, okay? That you understand how to use a CPT, you understand how to use ICD-10 PCS, and these are 2 completely different frames of mind when it comes to the procedures. And so you have to understand that because in CPT, all of those codes are already all assembled. The only thing that changes is, of course, if you have to add a modifier to it, right? And modifier is going to tell a little bit more of the story. Whereas in ICD-10 PCS, these are 7-character codes that are sometimes, because like there's some that are already built together, right? And because there's really like only one way to do that procedure. But then there's a lot of the other procedures where it's a combination, and it could be different things depending on what the patient came in for that surgery. Some of these are for biopsies. Some of these are like diagnostic. So it would be diagnostic, or it would be no qualifier. So basically they were just doing the surgery to do the surgery for whatever the purpose was. But if they were doing it for a diagnostic purpose, then you could designate that in that 7 characters if you're coding for ICD-10 PCS. Now, I know a lot of what I said is kind of like, woo. But again, if you're studying, or if your program is saying, hey, yes, we will train you in ICD-10 CM, ICD-10 PCS, and CPT, and you say, okay, so that means I can choose between the CCA or the CCS. And sometimes they push you for one over the other. Sometimes they say, well, don't worry about the CCA, try to go for the CCS. There are some schools that will do that. And if they trained you well, and you can, and you feel confident enough, then by all means you go for it. But if you say, well, I didn't really like ICD-10 PCS, I really don't understand like trying to put together the codes, but I really liked the outpatient side. Even if they trained you for inpatient, you can still choose to take the Ccs-P, the Certified Coding Specialist Physician Base, or you could take the CPC with AAPC. It's entirely up to you, okay? But it really, again, it all depends on which one you want to sit for. You just need to pick one. Now, how did I pick the certification that I was going to take when I first got into school? Well, of course, I didn't know medical coders even existed. I didn't even know what it was. So because I did not know, when I went to the school and I finally chose the school that I wanted to go to, the lady, she was very nice, and she explained the differences between AHIMA and AAPC. And she told me the best thing that you can do, because we can't tell you which one to take, but the best thing that we can do is to tell you to look at the job listings and see what the employers are asking for. And so I went home that night and I saw there was a lot of people asking for AHIMA credentials, a lot of people asking for the CCA or the CCS or the Ccs-P. So I said, okay, well then I guess I can sit for the CCA then, because they're asking for it a lot in my area. And some areas you're going to see a lot of AAPC dominance in that area. Where I'm at now, at my hospital, I'm still one of a handful of people who have an AHIMA certification, and I'm only one of 2 that holds the CCS. Only one of 2 that holds the CCS. So that goes to show you. But again, when I first started here and I had the CCA, there was a lot of people that gave me a hard time. They said, well, aren't you going to get the CPC so you could be like us? I go, if I get the CPC, then that means what would be the purpose of me having the CCA? And then I would give up, me being able to say, hey, I have inpatient or outpatient versatility. I can go anywhere. That doesn't make any sense. So I held fast because nobody can tell me what to do as far as like something like that. I know that with the CCA, a lot of people, they don't understand it. Well, I made them understand, and I was able to change hearts and minds, and I'm fine with that. And I'm really glad I did it. And I would do it again, and I would still carry the CCA if AHIMA would let me, but they don't. But that's okay. I have what I have now. I have the Ccs-P and I have the CCS. Why do I carry them both? Because, of course, I earned them both. I got the Ccs-P first, and then in the same year, I got the CCS. So, I mean, it's up to you in your journey. But again, at the time that I got the Ccs-P, right, I finally let go of my CCA. It was 13 years later. So I've earned it. And I've earned the right to have multiple credentials. When you're brand new, I will tell you this, and let me hold your hand while I say this. you need to concentrate on learning, not being worried about trying to keep up with the Joneses, or such and such has all these credentials, I want to be just like them. Do you know people who have multiple credentials can sometimes not code very well? They're just really good at taking tests. And I'm not saying that to insult anybody, and I'm not trying to give away anybody's secret. What I am trying to say is this, is that when it comes to brand new medical coders, I don't want them taken advantage of. And I see the impact of people who have been taken advantage of. I get those emails from people upset and crying and telling me, oh, Blue, my teacher told me I needed to get all these credentials. This one fellow, he said he had to get 4 because his teacher kept pushing him. And now he doesn't know how he's going to keep up with the CEUs. He doesn't even have a job. And he doesn't know how he's going to make it. And to be an educator, so-called educator, and push people like that when you know they don't have the money and you're just pushing them to get credentials and they still don't understand, that isn't right. And that's unethical, in my opinion. Okay, so that's the thing that I will say. But again, there's a lot of people who are so focused and they are in a trance, basically, of like, no, this person said that I need all these credentials, I'm going to do that. You're wrong, Blue. I've heard that time and time again. But again, I'm not here to sell you anything. I am here to help you to get prepared for the real world by letting you know what the truth is. Because I don't have a dog in the fight. If you decide to go through with medical billing and coding, great. If you decide not to, that's wonderful, because at least you know that this was not for you. Rather than go through something and be not really, having your heart in it. That's really bad. But, that's just what I'm going to say there. But here's the thing, guys. Pick one. All you need is one. You do not need 2. You do not need to be certified through both AHIMA and AAPC. Pick one. All you need is one. Save your money. Earn your money. Wouldn't you rather have more of your own money in the first year? Because again, all these other credentials that you're tacking on, that are employers even looking for them. And so they say, oh, well, no, I need to get the CRC. That's just diagnosis coding. What are you tested on in the CCS, CCA, Ccs-P, or the CPC? Diagnosis coding. And they even say in those job listings too, that we will accept CCA, CCS, Ccs-P, or the CPC. And then they may say, oh, CRC preferred. Preferred does not mean required. That's what I'm going to say there. So anyway, with that said, best of luck to you. Pick one and just go with it. You can't go wrong. Either way you go, okay? You cannot go wrong. You're just going to spend a little bit more money if you go with AAPC. But for some of you, you just need that extra option of having the retake and paying a little bit more for it. It's totally fine, guys. It's totally fine. It's whatever you choose to do, but stick with one and you can't go wrong. At least that's just my advice anyway. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see you all next time. Bye.